In this next module, we're going to look at motivation in practice and how to motivate groups to engage in the activities and the topics that you want them to. The first time, once again, we're just reading the standard definition and starting with elicitation questions. In the second one, we start with commonalities and ways that we can get the patients involved and connected to their own life experiences and motivated to participate. Okay, so our topic today is going to be epigenetics, which is the study of how your behavioral and environment can cause changes that affect the way your genes work. So several lifestyle factors have been identified that might modify epigenetic patterns such as diet, obesity, physical activity, tobacco, smoking, alcohol consumption, environment, pollutants, psychological stress, even working night shifts. So we know that some people may have a higher genetic propensity for addictive behavior.
We're watching the facilitator read a complex definition from a manual to a disengaged room. There is no way to know what patients know about the topic because only the facilitator is talking, and no one is motivated to participate or engage the topic.
Influence the decisions that you're making now.
I think I'm gonna try and eat better and quit smoking.
Okay, so sticking with our theme of epigenetics, do you know anyone who has found recovery successfully? Keith, how about you?
Yes.
Yes. Okay. And do you know anyone who has found recovery? John?
Kinda.
Kinda?
Yeah.
Okay, so yes. Do you think that people who leave treatment, do you think that they find recovery? Do you think it's possible for them? Drew, what do you think?
Do I think it's possible?
Yeah.
Yeah.
Okay, so
In this example, we watch the facilitator connect the session topic to the patient's life experience and background knowledge about others with similar struggles who found recovery. The facilitator uses an engagement technique of random toss to keep everyone's attention.
Yeah, I'm gonna repeat the cycle forever. That's what people like me to do.
Well, but we just heard from the rest of the room that recovery is absolutely possible. Some of you know people who have struggled with substance use in the past and have found recovery. You know, a lot of the counselors who work in this field have struggled in the past and find recovery. In fact, you might be surprised to find out that 75% of people who struggle with substance use at one point in their life actually find recovery. Does that surprise you to hear that kind of stat? Let's go back.
It does surprise me.
It does surprise you. But what does this tell us about how genes work? What does it tell us about how genes work?
That they can change.
Yes, that they can absolutely change.